Hello viewers and welcome to KID-AFAN Salone Discoveries. I am Asanatola Belsila. The Discovery team is present at the Bintumani Hotel where Health Alert and their partners are organizing the National Youth and Adolescent Conference. What's the theme for this year? Do you want to know? Well, let's discover this together.
She might be that advocacy might be bolder than some CFN, which we normally call short as Yanka. She served as a radio presenter. She's smart advocate and she's passionate about adolescents and especially family planning. The adjectives are not too sufficient to describe our chairperson. Continue clapping. Keep on clapping. Ladies and gentlemen, our host for today is Natalie Judy. Continue clapping. Our host.
Thank you so much. Thank you so much, Philippa. Honorable Deputy Minister, I am Natalie Judy. Give no more for the introduction, and we are happy to be here. And as young people, in our midst, we have the Honorable Deputy Minister One, who is so passionate about what we are doing, about family planning, about young people to be specific. So he has a whole lot of activity. But Honorable Deputy Minister, with the young people, we are so proud to have you here because this conference is so close to our hearts, and we have colleagues from Falaba districts, the Hatch communities, Koinadugu, which are for family planning. This is something so close to our hearts as young people. And we want to be talking for us, using our voices. So it's an honor to have you here. I mean, we are happy to have the Deputy Minister. Let's give you a round of applause. I'm leaving all that I have to be here. That's what we want to have in the keynote, and then we continue. Thank you.
Good morning to you all. Greetings from the leadership of the country, His Excellency the President. I bring you greetings from the leadership of the Minister of Health, and to say that you have our unwavering support. And it is indeed an honor to address you today at the National Youth and Adolescent Family Planning Conference 2024. Since its inception in 2019, this conference has become an essential platform for empowering young people and to drive change. Co-hosted by us the Minister of Health since 2022, it has provided us with critical recommendations that have shaped national policies and programs focused on youth and adolescent health. And I'm really happy that our director himself is here, Dr. Tom Sise, and Madam Nadia, all the members of the high team to push forward this vision. Indeed, it is very refreshing that the theme of this year's conference, young people creating cycles and building futures. And it is very important that we go beyond our normal activities to create that cycle of things that we think are not normally easy to do. I.e., we have to be ambitious so that we can build a future that is fit for purpose for Sierra Leone. And this thing reflects our collective commitment to creating a future where young people have the knowledge, resource, human, material, and financial, and agency to make informed decisions about their sexual and reproductive health. This thing embodies the vision of sustainable Sierra Leone, where youth are the heart of our development agenda. And this is very, very well correct because in Sierra Leone we have a youthful population. The average age of the Sierra Leonean is 19 years, which means you are the future leaders of today and tomorrow. And so we have a lot of passion for what you do, which is why under very difficult circumstances, I made myself available here this morning to interact with you and to show how much importance you have for us and how much we rely on you people to take care of us very soon. Sierra Leone will continue to make big headlines, not only being member of the Security Council, they are chair, but yesterday I was very honored as a Sierra Leonean, very proud as a Sierra Leonean, to send a medical team to Rwanda where there's an outbreak of infectious disease. We have built the capacity in this tiny nation of ours. Now we are reaching out to countries that seem far advanced than us, but yet still come to us to ask about medical health. I've overseen that agency and I'm really proud to be a Sierra Leonean, and I hope you, the younger generation, will build upon that legacy so that you can go to even higher heights. The Minister of Health continues to prioritize initiatives that empower young people what it means to live healthy and fulfilling lives. This initiative now being implemented by young people in Kenema district with the backing of the DHM team-led by Dr. Grant is a powerful example of how we are co-creating solutions to overcome barriers to youth-friendly SRH and family planning services. We will be proud of the collaboration and innovation demonstrated by our youth, and congratulations once more. Let us continue to seize the opportunity to stage a brighter, healthier future for our young generation. I thank you very much.
USA recognizes that family planning, along with reproductive, maternal, newborn, child, and adolescent health, we have an acronym for that. USA has lots of acronyms. They are key areas that USA has supported and will continue to support the government of Sierra Leone and all of the people of Sierra Leone. Family planning is the most cost-effective intervention to prevent maternal and newborn deaths. Despite the progress that the Sierra Leone has made and its partners have made in recent years to increase the availability and quality of family planning services, challenges remain. Sierra Leone's contraceptive prevalence rate is still very low, only 24% among women aged 15 to 49. Additionally, the country continues to face one of the highest rates of adolescent pregnancy. 21% of girls aged 15 to 19 have already begun childbearing. Also, alarmingly, nearly half, 46.8% of adolescent girls' deaths are related to complications during childbirth. During the conference last year, FP Youth Connect emerged as the winner with their proposal to use the Family Planning KK, the service to address challenges and improve access to information and services in Kenema District. If you go to Kenema District and you see the KKs, you will see the messages that are posted there. This initiative has since been launched, and we look forward to hearing about the lessons that we've learned so far and how this can be encouraged and spread to more parts of the country and to be driven by youth, of course.
By enabling young people to delay pregnancy and parenthood until they are physically, emotionally, and financially ready. This allows them to safeguard their health, complete their education, enter the workforce, and pursue their dreams in life. Family planning and the realization of sexual and reproductive health and rights of young people are therefore powerful contributors to building prosperous families and communities and to building a prosperous nation. The government of Sierra Leone has made strong commitments to expanding access to family planning and reproductive health services. As UNFPA, we stand firmly behind the principle that young people should not only be beneficiaries of development programs, but that you have to be leaders in driving positive change. So as we come together today, let us take this opportunity to strengthen our partnerships, to continue to drive innovative solutions, and to advocate for strategic investments. Together, we can build a future where family planning services are accessible to all who need them, and where every young person has that freedom and that power to choose their path. I thank you very much, and I wish you a highly inspiring, collaborative, and successful conference. Thank you.
As we know, the sexual and reproductive health and rights of adolescents and youth must be fulfilled to achieve the Sustainable Development Goals, improve adolescent and youth health outcome, generate a triple dividend, and that's why it's always a win-win. It is for the adolescent today, the adults they will become, and the family they may choose to have. Sierra Leone people's reproductive health outcomes in general. As I got into Freetown, I then discovered that truly nothing is free, even in Freetown, as I was charged $25 for security at the airport. This underscores that supporting youth-led and women-led grassroots organization as key agents of change is not cheap, neither is it free. It is time for all the partners, including government, to put in the money right where we want the progress to be. Invest now. Invest for a better, a brighter future today. Young people, don't let anybody tell you otherwise. We are leaders today who are leading right now. You've got all it takes and you're unstoppable. Thank you so much.
Let's give him a round of applause.
Let us ensure that the knowledge is taken out there to those that need it the most. Let us work very hard so that all our vulnerable young people can be empowered, and we believe that will ensure that we are able to break the cycle. A lot of times when people talk about family planning, there are a lot of misconceptions around. People say, oh, these people, they want to reduce the population in Africa, or they will have other things that they will say. But listening to Margaret, I think she explained her situation actually reflects what family planning is about. Where a couple sits down together, have a discussion about how the family should look like, and actually work towards that. And of course, even if they don't have the 3, 2 is also not a bad number. And I think they've done very well. I think, is that not the kind of family we want to see? Yeah, so I think we want to applaud all of you. On our part, as a Ministry of Health, what we're doing is ensuring that we have the right policies. We'll be working on the family planning policy. We worked on a strategic document called the Process Implementation Plan, which articulates how we are going to provide family planning services up to 2027. Right? And I think those documents, you can try to look at them, but I think it provides a guide, not only for us as the Ministry of Health, but all the partners that we work with to ensure that we are guided by documents on how we provide services. So all our other partners, of course, Japan, MCGL, Health and Arts, and our colleague from FP 2030, Margaret, I think all of them have been very supportive. But particularly you as young people, my final appeal to you is to ensure that let us take the message to the most vulnerable. Let us take the message to those that need it most, so that we can break the cycle and ensure that young people are empowered in this country for overall national development. So I thank you so much for listening.
When the father speaks, he assures his children. He wants to recognize the presence of other very important people who are not here with us in the IT board. They are here with us. The country director of My Stop, Sierra Leone, Mr. Mohamed Kaba. We also have with us the director of programs and operations from My Stop as well, Mr. Benya.
Good morning. It's a pleasure to welcome you all here today. Like colleagues have mentioned, this is the 3rd youth conference, National Adolescent Family Planning Conference that USA Momentum is partnering with Health Alert to, organize. And it has been a pleasure to work with you. The progress we've made over the years. Remember the first one in 2022. We had it was organized by a lot of the MCGA implementing partners, and we said the next one will be led, organized, and planned by youth. That was 2023, and you did a phenomenal job. And we said the other one, this one, from the agenda to the speakers, to everything. there are various speakers, you know, you are all FP champions. You are all champions of breaking toxic cycles. You're the future, and the future starts now. Future also next year, it's not 10 years from now. You are the future, and your future begins today. In fact, we are mission. So, I want to wrap up this conference and say thank you all, and to the USA Momentum Partnership, like everyone in the implementing partners. You know, we have done such a great job. This has not been like coordinating all the districts and all of that. And also to the leadership of the Ministry of Health for always fully participating in this. Like, we cannot do this without the government of Sierra Leone. Like Dr. Thompson said, you've made very enabling environments for us to pick and do this. And partnerships. You know, we don't believe this is a one person's job. This is not all man. From you to our partners, UNFPA, FP 2030, my Stokes, all the other partners here. So on behalf of implementing partners, on behalf of USA West, the one funding this consortium, I want to sincerely thank you for a very, very, very fruitful, productive, innovative conference. Okay? Thank you all.
Thank you so much.
Giving them the space, power shifting power. That's what we are doing. This being a long journey, of 4 years back. And that journey started with a friend whom we bet on and said, no, Sierra Leone don't have the space to provide young people to family planning. And you are talking about family planning 2020. Nobody knows about it here in Israel. Can you just give us a tip that can take us forward? And here we are today. Thanks to FP 2030, my lecture was FP 2020. Margaret is here. Margaret flew all the way from Abuja. I met her in Abuja a few weeks ago, and Tony Victor. Which also has been a long marathon document, young people have been participating. They have been sending all their messages. They have been saying whatever it is about projects. So what we did as civil society is to build the capacity of the young people. Hence, we train them on smart advocacy. Doing that can facilitate to them a training on smart advocacy. Trust me, she has got that capacity. We also train them on social accountability. How can they hold duty bearers accountable for the services they provide family planning? We also train them on budget tracking. Today they can track budget, especially for family planning. These are the knowledge, these are the capacities they have had as a result of this partnership. So good support partners that are supporting, including the ministry. This is the progress we are talking about. Before that conference, we all knew the matter of mortality. It was extremely unacceptable. Very high. We were talking about over 1,000 and some 100 over 100,000. This was unacceptable. What is going to be the conclusion of the young people? But I tell you, because of the frequent engagement young people have with the council, stakeholders, they go to this council, they have even signed commitment with council family to make sure they include family planning in their budget. Clap for young people. Clap for young people. Yes. To prioritize family planning, they have done that. They engage them. They go to schools. They engage the young in the schools. That is what they have been doing. It is all as a result of this engagement and our work there. So today we are here witnessing cooperation. We are witnessing co-design. We are witnessing innovators that are coming from there. And I'll tell you what, these innovations, these recommendations, where they asked us to be on the table, give them all of these fruits. And those recommendations, Dr. Tomia, that attest all of the policies that be able to influence, including national policies. 2019 was the number of what? The Sexual Reproductive Act. Again, we saw this year the president also launched what? The early child marriage and a host of other policies. This has been part of the success story. So today, without talking much, back seat. I am behind watching at you. It's you driving the seat. It's you leading all of us. We are behind you. We know you will not let us down. We know you are not going to be a bad driver because you are already with us. You have the driving license. You have everything it takes for you to lead this matter. So thank you very much. Thank you very much. Thank you very much. I just want to conclude by thanking all the team, by our dynamic sister, Madam Benu, for steering, for leading the consortium, and also our sister, Najima. Clap for Najima. Let's thank Najima has been here. Our brother, Abu Karon, where are you? He has also been to be Abu Karon. Thank you very much. And then Sister Green, these people have been behind, pushing us. But you know what? I will not sit here without loading my program manager. That thing done, and the whole team of lecturer and the administration. That thing, AFAN, everybody, thank you very much. Sugar, the cameraman, everyone, and the media, thank you very much. We God bless you. Thank you.
Young people that we want to be taught about family planning, sex education from school. Now we have tailored messages, that will be starting from our school, where young people are listening to be well informed when they grow up about, their health, their life skills, that has to do with sexual reproductive health and rights. And that's all is because of this conference. When we came as young people, we are so strong. We want a curriculum. We want this to go to our school. So now as young people, it's a win for us as we now have Charles as part of our school curriculum. And young people, are we ready for the next speaker? Are we ready? I want us to give you a standing ovation as I welcome the team lead for the Adolescent and Youth Mechanism.
Well, kudos to my colleagues, young people you heard from Judy. They all came in as participants. We are others to support me. And in that vein, they were also able to join this journey that we're here for today. 2020, there was no support to continue this conference. 2021, there was no support. Not until when the USA came with the MCGL project, then we were able to resume or continue this brilliant idea again. Hadn't been so, we shouldn't have got ideas like the Tech initiative, among other initiatives, Tech for Family Planning. So USA needs to be commended. Just as I'm recommending UNFPA, Maristops, who I know will support us subsequent years. Definitely, I'm sure they are going to play that here. As AY mechanism, we want to go to chief of level, village level, possibly in every northern county of Sierra Leone, but you should support us. Again, we want you people to entrust trust in us. You had the place, and trust in us. Yes. You can give us money to implement activities. We are accountable. If we are holding people accountable, we ourselves are accountable. You had the executive director of Health telling you that we've undergone series of trainings.
Alright viewers, we get with one participant. It can tell we in name and a region where it comes for. Over to you.
Mina Augusta Kasivi, I come out from Kenema, and Namina the regional coordinator for Eastern Region AY Mechanism.
So how this National Youth Conference program for the past 3 years don't impact your life?
And it don't impact me in so many ways, because like most times we be done the same as barrier as taboo for talk about family planning, and we be done the same and say if you talk about family planning, they send pikin go na street, they waiting safe. But the conference helped me for understand say family planning no mean say na for send pikin go na street. It no mean say family planning na for make pikin go na ski go get belle there with them day. But it not only limited to the contraceptive then way like people take, but it also involving how you dey plan your life, how you dey plan your education, when you go born, and how many pikin you go willing for born. So like the conference don impact my life in so many ways and so many others, because like just after the conference we can reach out now with different districts for educate we company them.
Thank you so much.
Yeah, you're welcome.
All right, viewers, we get with Edward Charles wey happen for comot na Pujon district, and I'm first conference this for make it attend. So it can tell we how important this be to her, especially as a young man.
Yeah, really, the conference is really important, because through the conference I get for learn a lot, so that when I get for return I go able disseminate the message to my colleagues then, so that they go able learn when they will get chance for come. Yeah.
Thank you.
Yeah, welcome.
Ketura Bangura na in second this for attending Canada conference there. So it can tell we how we serve the use in knowledge where it don't they get within the Waterloo community for help in comping gal picking them in terms of family planning. Over to you.
Well, actually, me not be one person way be the frown against family planning, because like maybe they think and say we gal picking join family planning and go just they come out bad and all. So I know be actually like the idea of family planning, but what come last year, them give me knowledge about family planning, and need a mega picking jump na treat, but also for protect the picking from early teenage pregnancy and all. So after the conference, meet with me Didi and some of my colleagues them na school, tell them about family planning and tell them say family planning a good thing, and need a pull picking a treat.
Thank you.
You're welcome.
Me na Adolescent for the Cabo, the regional coordinator for the Adolescent and Youth Mechanism inside Sierra Leone at the Northwest region. And this conference, me being the second time for attend don't create the platform for let we include more other young people into the front line of advocacy towards family planning and sexual reproductive health. Because we know young people at this age, we so technologically they in line with every other social media handles, and we quickly for one practicalize what they see. So in other words, young people, we are sexually active now, so without getting the required knowledge, wait for enough for safeguard we and help safeguard with other colleagues, they will not get the message they are it, then we'll not go get a brighter future where we want yearn for being the future leaders. So being the future leader starts now. So as a young people, we don't they see how best we don't they advocate for policy shifts where they able guide and protect young one them for let they able realize their potential. Recently we don't see the abolition of the child marriage where president himself already don't sign. That now one part we advocacy we don't they do. And again we don't they see the level of the availability of the family planning commodities. Before this time, young person they go seek family planning service of any commodity, whether na depot now what can commodity call, you know, the pills, the IUD, but the health workers them maybe not too friendly with your colleague young people. They, hey, come on here, not what you want to do steer for, but the youths and the young people already they into this sexual act. So as young people, we want to see how would they safeguard ourselves so that at the end of the day we not go get unwanted pregnancy, we not they get sexually transmitted infections where go claim we lives, where we will die, and increase what we call maternal mortality rate.
Thank you so much.
Thank you.
All right, viewers, thank you so much for discovering this particular edition with me together, and a big thanks to our executive producer Dr. Aissatou Kakejalo. Thank you also to our camera operator Abubakar Tawali. I am Asanatou Labelsela. Till we meet for another edition. Goodbye.